Hey, I'm here with Chris Ward, who is the Chief Marketing Officer of GE Healthcare. Thanks for taking the time to meet with me, Chris.
You bet.
So, what's the GE Healthcare message here at HIMSS?
Pretty simple. Our overall message you see appearing throughout the booth and in our advanced communications, and really for the next foreseeable future, is we mean IT. So it's obviously a double entendre that plays off of meaningful use, but it's also we mean it. Yeah. We're very committed to this space, and so there's really three core messages that underlie that. One is that innovation is we mean innovation, and you think about the size of our market share and the ideas that come from that installed base. I mean, we don't have dominant or outsized market shares, but we have good market share to give us a lot of ideas. We're also multinational, so we have ideas about what's happening in Southeast Asia and health exchange, or how is it done elsewhere in other parts of the world. So all that means a lot of good innovation possible with our resources and our funding behind all that. The second thing is advocacy. Healthcare IT, GE Healthcare IT means advocacy. So we're pretty well connected in Washington, D.C., and we're able to cover a lot of spaces, a lot of groups, a lot of ground there, and be able to share with providers what we're seeing going on there. But it's also, because of that install base that I mentioned previously, we know a little bit about what providers are thinking, and we're able to reflect that back into the development and shape of our overall industry. And last, health imagination. So for your readers and yourself in the North American market, with the Olympics just concluding, you probably saw some of our spots in primetime rotation. There were 4 or 5 spots. One of us featured EMR. But health imagination is all about our commitment, GE's commitment, to help and solving some of the bigger healthcare problems in the world. So it's really, those advocacy, innovation, and health imagination supporting the idea of we mean IT.
What does health imagination mean to an IT director?
It means a number of things. First of all, it's a company that's absolutely committed to the space, that we want to drive 3 core things. One is we want to increase access to care. So we all know in different parts of the world or in the U.S. there's just not enough care or not enough access to quality care. The second thing is driving increased quality. So what we know is that when you drive quality up, in most instances, you inversely drive cost down. We've learned that very well in working with Intermountain Healthcare and the Mayo Clinic with our Qualibria product, which I'll talk about a bit later.
Yeah, let's talk about that. That's a new product that you have just announced recently.
New to the world yesterday, yeah. Day one of HIMSS. So Qualibria is our clinical knowledge platform that is really doing 2 things. First of all, it's wrapping around an EMR, so it's a vendor-neutral, vendor-agnostic. It's not just a GE proprietary system, but we're happy to augment somebody else's EMR, of course. And what it does is it's taking best practice clinical care guidelines, whether that comes from the institution, the IDN, or it comes from another group. We take those best practice care guidelines, and then we combine that with taking all of the patient data that's out there in the system from disparate IT systems and putting it into one system. So now when you take kind of 1 + 1 together, it means that you have a much more controllable way of delivering care inside of an institution.
That's fantastic. So ARA is a big deal here at HIMSS. What are you doing to help your clients take advantage of that?
Yeah, a number of ways. So obviously achieving meaningful use, and we're right now at an interim final rule, so we don't quite know where it's going. We have a pretty good sense of it. Again, we're pretty plugged in on the advocacy front, but helping people to understand what it is first part, just the overall awareness and education. The second thing are innovations like Stimulus Simplicity, which is our name for a financing program that is 0% interest, and it's also deferred payments. So in short, you don't pay us until you receive monies. And so that is something, we worry about industry capacity, people being able to deploy the technologies. We're helping to solve for some of that by moving that forward. If you're in your decision process now, no need to wait. You can go ahead and do it now at pretty low risk. We also offer a warranty behind that we will meet the certification requirements when they're finally locked down.
That's fantastic. So anything that GE Healthcare is doing in the social media space?
Yeah, there's a number of things. So around health imagination, for instance, I know I have on my my Droid, Droid-based phone, we have an application called Morsel, which is kind of pushing out little factoids on health imagination. Drink a couple of glasses of water before you eat a meal, and it'll kind of suppress your appetite. Little things like that on a consumer level. We also have a YouTube channel. We have a Facebook page on there. So there's a number of things we're investing in. Are we at the cutting edge? No, we're not, but we're investing in it right now.
Okay, fantastic. Thanks for your time, Chris.
You bet. Thanks very much.